بسم الله الرحمن الرحيم. I'm happy to be with you. سعيدة جدا برجوعي تاني لأصلي، لأن أنا بدأت حياتي هنا في جامعة المنيا مدرس مساعد، وفرصة جميلة أن أنا أبقى معاكم. أقول كل سنة وأنتم طيبين، رمضان وأعياد المسيحيين وعيد الأم، وبشكر الأم الجميلة الدكتورة وجيه مسعود، الأستاذة الدكتورة وجيه مسعود، الأم بتاعت جامعة المنيا والأساس في هذا البناء الكبير، وولادها بعد كده فوق المشرفين ما شاء الله. فرحت بيهم جدا يا دكتورة وجيه، وشفتهم بعد كل هذه السنين، حاجة ما شاء الله تفرح. بشكر الأستاذة الدكتورة ليلى حمودة والأستاذ الدكتور محمود جنيدي على دعوتهم. ألف شكر. I will discuss with you Leucocoria in pediatric age group ultrasound findings. Well, I will not say all the contents of this lecture because it is too long. However, we correlate, take history, examine what is ultrasound principles, indications, leucocoria and ultrasound, how to write and interpret findings. أنا همشي بسرعة لأني I was not scheduled to this, but I'm happy to be with you. Eyes do not see what mind does not know. يعني لازم لما أكون بفحص عيان بكون عارفة أنا بدور على إيه. لو مش عارفة أنا بدور على إيه، زي ما حضرتك تخش أوضة وأنت مش عارف بتدور على إيه، النضارة ولا الموبايل، فلازم أكون مركزة أنا عايزة إيه بالظبط. ده النورمال ultrasound حضراتكم كلكم oriented بيه. What is leucocoria? Leuco means white, coria means pupil. It is the white appearance of the pupil due to the presence of a whitish opaque tissue behind the lens. Two questions I should ask to myself: where is the problem anatomical, and what is the problem, what is the pathology? Is it congenital, acquired, traumatic, tumors, what? Differential diagnosis of leucocoria: tumors, retinoblastoma, and medalloepithelioma. Developmental abnormalities: persistent hyperplastic primary vitreous, coloboma, medullated nerve fiber disease, congenital cataract, retinopathy of prematurity, coats, retinal detachment, incontinentia pigmenti, infections, endophthalmitis, toxocariasis, and toxoplasmosis. Well, we should ask ourselves, is it unilateral or bilateral? Bilateral disease, retinoblastoma and retinopathy of prematurity. We should evaluate the axial lens. Is it normal or short? Short, usually with persistent hyperplastic primary vitreous and retinopathy of prematurity. Main findings: if I find calcification in the ultrasound, it is retinoblastoma. Total retinal detachment with loops, it is retinopathy of prematurity. Exudative Coats disease. Vitreous bands extending from the optic nerve to the lens, it is persistent hyperplastic primary vitreous. Retinoblastoma, it is the most common primary malignant tumor in children. Origin from retinoblasts of primitive nuclear layer. Tumors may occur in more than one foci. We have two types. We are oriented with the glioma endophytum. That means it extends towards the vitreous, or exophytum between the retina and choroid. By ultrasound, what do we see? We see a smooth dome-shaped or irregular configuration. Calcification is diagnostic, shadowing of the adjacent sclera and orbit. We use the ultrasound in both diagnosis and prognosis, as we can measure the base of the tumor and the height of the tumor after the chemotherapy given to a child. This is also a retinoblastoma with calcification. The second disease we may find is retinopathy of prematurity, with history of less than 28 weeks gestation, less than 1,500 gram, hyperoxia, shock, sepsis, asphyxia. Pathophysiology: injury to the immature developing retinal capillary bed. Retinal blood vessels grow into the vitreous, stage 3, leading to vitreous hemorrhage, scarring, contraction of the vitreous folds, and finally retinal detachment. These are my own photos of a patient with retinopathy of prematurity. Funnel-shaped retinal detachment and dense opacities are seen within the funnel, and this is stage 5. Coats disease. It is usually unilateral in boys, age late, subretinal exudates and exudative retinal detachment. This is severe Coats with funnel-shaped retinal detachment. We usually see low reflective echoes from subretinal cholesterol. Toxocara. Granuloma in the posterior pole, usually unilateral. Mild to moderate elevated granuloma with vitreous membranes extending from the granuloma to the posterior pole. Posterior tractional retinal detachment. Coloboma. Coloboma of the optic disc. We usually can detect it by ultrasound. Retinal detachment. Persistent hyperplastic primary vitreous, usually unilateral. Microphthalmic eye, retrolental mass in which elongated ciliary processes are inserted. It may or may not accompanied by cataract. By ultrasound, we can see a band extending from the back of the lens to the optic nerve. Endophthalmitis. It may be endogenous or exogenous. We usually find it as exogenous in trauma of children. Endogenous may be also post-operative. Medalloepithelioma. It arises from the pars ciliaris retinae between the age of 0 to 9 years. It's locally malignant and spreads circumferentially. Congenital cataract, we usually by ultrasound see the vitreous clear and the retina on. If you can get only one message from my presentation, then I would like to emphasize on whenever you find leucocoria in pediatric age group, kindly exclude retinoblastoma. لو مش هتفيد العيان ما تضروش. Our take home message is take proper history. ممكن معلش أقول take home message. Take proper history and examine clinical. Ask what I am looking for and its differential diagnosis. Don't jump to a diagnosis. Examine and write your report in a systematic manner. Ultrasound in leucocoria is an easy, non-invasive tool. Retinoblastoma should be looked for carefully in a child with leucocoria. Think by the brain of a medicine and the hands of a surgeon. The financial crisis is unlikely to worry me. I lay a new golden egg every day. The golden egg is education. Thank you very much.
Thank you.